Hello again, it's Dr. Barton from the Colorado Center for Reproductive Medicine in Denver, Colorado. Today I'm going to briefly discuss the process of oocyte or egg donation. So who needs an egg donor? Egg donors are used for a variety of reasons. Most commonly, women who are postmenopausal, of extremely advanced reproductive age, have failed multiple treatment attempts with their own eggs, or women with significantly low egg count or diminished ovarian reserve who might have a poor prognosis with their own eggs. Also, gay and single men use egg donors, as well as people who may wish to avoid an inherited or genetic disease in some circumstances. Who are egg donors? Egg donors are typically anonymous, although if you know someone that you would like to be your egg donor, she can undergo evaluations for donating for you as well. Egg donors in our practice who are anonymous need to be aged 33 years or younger and have normal fertility markers in order to donate. Egg donors undergo a significant amount of screening from an infectious disease standpoint, genetic carrier screening, and meeting with a psychologist. They also undergo, as previously mentioned, fertility testing to ensure that they are a good candidate to donate. Once a donor has been determined to be a good candidate to donate, she undergoes the first half of an IVF cycle. This includes taking hormonal medications to stimulate growth of eggs in her ovary and a surgical procedure to extract those eggs. Those eggs are then donated or provided to the intended parents and the recipients of egg donation. Eggs can be either fresh or frozen. Fresh eggs mean that the eggs are fertilized with sperm, either an intended parent's sperm or from a sperm donor if there is no male partner in the relationship. And the embryos are grown and then implanted into the uterus of the intended female parent, or in some cases, a surrogate or gestational carrier. Fresh eggs mean those eggs were not frozen prior to them being fertilized. In other cases, an increasingly common type of treatment is frozen donor eggs. In this scenario, the egg donor has already gone through her evaluations, completed her IVF stimulation and egg retrieval, and those eggs were frozen until they were selected by an intended parent. There are pros and cons of fresh versus frozen donor eggs, and this is something that you should discuss with your individual practitioner and to meet your individual family goals. Many people will ask me what they get to learn about the donor if in an anonymous situation. You are provided with a profile of that donor and provided with information regarding her genetic carrier screening, her personality based on an interview, her educational background, her ethnic background, and her physical characteristics. There are several steps that an intended parent, couple, or individual need to take prior to pursuing egg donation. This includes, in most cases, uterine evaluations and health evaluations regarding safety of pregnancy. It is possible for women to receive egg donation even if they are menopausal, have a delivery, and even complete things such as breastfeeding if they desire after delivery. The recipient couple or individual will also undergo infectious disease screening, and if there is a male partner, he will complete sperm testing and genetic carrier screening that will be matched against the egg donor to ensure that we are not putting a couple at risk for having a baby with a recessive genetic condition. All recipients of egg donation will also undergo a counseling session to discuss issues related to third-party reproduction and how to disclose to children regarding how they came to be conceived. This process does take time. These are appointments that can be completed now in regards to providing you with information about our donor program, as well as the uterine evaluations, psychological evaluations, genetic testing, and sperm evaluations that need to be done prior to completing a treatment cycle. Thank you.